Hi again. Every time. This is the team from AROSSOUW Bios, and today me and Tash are going to talk to you about shoulder impingement.
Okay, so the shoulder is quite a complex joint. It's a multi-directional kind of
Movement
joint.
Yeah.
So there's a lot to it in terms of anatomy, bony structure, and then anatomy with your muscles. So what makes up the actual shoulder joint is your collarbone or your clavicle. Then you've got your shoulder blade or your scapula, and then your upper arm or your humerus. Okay. And then what happens is, in between all of this, what holds it together is a large group of muscles called your rotator cuff muscles. And they're made up of 4 different muscles. You've got 2 internal rotators and 2 external rotators. So pretty much what the rotator cuff muscle does is it holds the humerus or your upper arm bone in the shoulder capsule joint. So it will sit within a very fancy term called your glenoid fossa of your scapula. So it just sits in like a little socket. So if I can just show you quickly what the rotator cuff muscles are. You've got your supraspinatus and your subscapularis muscles. So those guys are responsible for internal rotation. And then you've got your infraspinatus and your teres minor, which are responsible for external rotation. And usually those are quite the most commonly injured ones as well, especially with your supraspinatus muscle. Okay, so between your rotator cuff and your acromion, so your acromion is basically called, it's the roof of your shoulder blade. Okay, and between the acromion and the rotator cuff, you've got a nice little bursa, which is a fluid-filled sac. And often it's there to prevent like friction build-up between the rotator cuff and the acromion. So if you have a repetitive movement, like an overhead movement, so your cricketers, your bowlers, your swimmers, those are the common people we'll see come in with the injury. That repetitive movement is going to flare up that bursa, and obviously it's going to cause a lot of tension on the actual tendons of the rotator cuff.
And that then can cause the impingement.
The impingement, yes. But another big thing is your bony anatomy or your bony structure. So that acromion, so it's like shaped like a little hook where the rotator cuff muscles run through. You've got 3 different types, surprisingly enough. So you've got your type 1, your type 2, and your type 3. So you can see it gets more curved as you go.
Yes.
So obviously the more curvature you have in the acromion, the more it's going to impinge on the actual tendon.
Alright.
And that's a problem.
Yes.
So
can we fix all of that, or is some of it surgical, and how do we know?
okay, so in terms of, obviously we'll do a few tests to see whether it is more of a muscular issue than a structural issue. If it is muscular, it's coming from weakness in the rotator cuff muscle. So we'll test which muscle it is, and then obviously treat it according to that. And if it's more of a tendon issue, then we'll treat it in terms of more of a tendinitis sort of thing.
Okay.
But if it is structurally related, there is a choice of, look, we can adjust your posture, try and open up the curvature of that hook, so it kind of offloads the pressure on the tendon. Else, if that does fail, which is more of a conservative treatment, then it is a possibility that surgical intervention needs to come into play. And they'll obviously show the way some of the bone just to open up that spacing.
So again, it's important to obviously get a proper diagnosis from a surgeon or sports physician.
Definitely.
So we know what we're dealing with. So you don't end up doing a whole bunch of rehab for nothing.
Yeah.
But if you do have surgery, end up having surgery, then it's very important as well to come for rehab to stabilize the shoulder blade again and to get the rotator cuff working properly and all of that.
Yeah.
Yes.
That's awesome.
Alright, so we're going to quickly show you some tests that we do, range of motion and some functional tests, and show you on the side legs a test that we can do as well to check the strength of the rotator cuff, so you can see how we actually assess them. Natasha, what symptoms will people have if they have shoulder impingement? What would they feel?
Okay, so it's more of a sharp pain initially on like movements with internal rotation, this sort of movement, and they'll also feel a lot of weakness in the muscle, and especially because your rotator cuff's purpose is to rotate and elevate the shoulder, they'll feel weakness in those types of movements. So basic things like reaching for a cup out of your cupboard, they'll feel a lot of weakness, and then it sometimes can be more of an achy pain. They'll feel it at night if they sleep on their shoulder. That would be a problem as well.
Okay. And the pain will be sort of in front of the shoulder.
It's very
over there,
localized.
and
Very
a lot of the times, like you said, if you go overhead, as
Yes.
soon as you sort of try and reach
90
overhead,
degrees and above.